Uh, my name my name is Dr. Mobadui. I'm the Chief Operating Officer of GET. Before we go on, please, for those joining us for the first time, permit me to talk about GET for 1 minute. GET is Global Emerging Pathogens Treatment Consortium, an organization that was set up exactly 10 years ago at the peak of the Ebola crisis that ravaged some countries in West Africa. It was clear during Ebola that West African countries lacked the capacity to cope with such level of health emergency, and there was a need to set up organizations, both government and non-government organizations, to build capacity to cope with emerging health and biosecurity threats in Africa. And my organization, Global Emerging Pathogens Treatment Consortium, was one of the organizations that was set up with the aim of working with both government and non-governmental organizations to build their capacity to cope with emerging health and biosecurity threats. We've been working in the last 10 years with different organizations, both within and outside the African continent, to achieve our aim, our goals, and objectives. GET is legally registered in Nigeria, Sierra Leone, Ghana, and the United States of America, and our headquarters is in Lagos, Nigeria. One of the platforms we use to educate our participants and to discuss emerging issues in the area of biosecurity and One Health is our monthly webinar. This webinar series, we've been organizing it in the last 3 years, and every month we'll discuss important issues in the area of health and biosecurity. And this month we'll be focusing on another very, very important issue, which is antimicrobial resistance. The topic of our webinar series today is antimicrobial resistance in Africa, challenges, innovations, and collaborative solutions. And we have top subject matter experts that will be discussing or analyzing the topic of today with us today. You agree with me that AMR is is becoming one of the biggest health issues, especially in Africa. WHO reported about 700 deaths are recorded directly as a result of AMR in Africa every year. And there's a projection that these deaths can rise to about 4 million within the next by the year 2050. That makes the issue of antimicrobial resistance very important, especially on the continent of Africa, and it has become very important for stakeholders, both government and non-governmental stakeholders, to work together to see how we can address this very emerging challenge that is facing us on the continent. And that is why we're organizing this webinar series today, to bring together stakeholders to see how we can find innovative solution to the issue of antimicrobial resistance in Africa. And we have 3 subject matter experts that will be speaking to us today. So without wasting our time, we'll go to the first speaker. But before we go to the first speaker, I'll lay down some rules that will be governing the webinar. Then I'll hand over the floor to the first speaker. We have 3 speakers that will be speaking on related issues, on AMR related issues this morning. And each of the speakers will be speaking for about 20 minutes. And after their presentations, they'll have time to answer questions from our participants. For participants that want to ask questions, you can go to the question and answer button on the Zoom link and write your questions there. And I'm sure our speakers will be very willing to respond to your questions. At the end of the webinar series, we'll give 1 or 2 participants 2 minutes to contribute to the discussion today. And our speakers will respond to the questions after their presentation. So thank you very much again for attending. We say a very big thank you to the speakers today and also our participants. Like I always say, the reason why we do this every month is our participants that we have from different countries all over the world that make it a day to be part of this webinar every month. So without wasting our time, I'll go to the first speaker. I will introduce the first speaker for about 1 minute. Then I'll hand over the floor for her to make her presentation. Our first speaker today is Dr. Watipaso Kasambara of the African Society of Laboratory Medicine. Dr. Kasambara is an antimicrobial resistance coordinator at the Ministry of Health, Lilongwe, Malawi. She's also the project manager of the African Society for Laboratory Medicine, ASL. Dr. Watipaso, we are very happy to have you today, and thank you for agreeing to be part of this webinar. I hand over the floor to you, please. Thank you.
Thank you so much for having ASLM as one of the speakers to this webinar today. We're so glad that we are part of this webinar this morning or afternoon, depending where you are. Allow me to share my slides. I just wanted to mention that I am not as the lead for the moderator for the session has led. I am not with Ministry of Health Malawi. I currently moved to ASLM, where I am a portfolio lead on antimicrobial resistance. So I will be presenting on the topic which I was channeled to present on challenges and drivers of antimicrobial resistance in Africa. I'll just highlight a few public health impacts as well as ecosystem according to the nature of the discussion today. So allow me, I'll just highlight some of the critical things which we have seen from the ASLM point of view. In ASLM, there's a work which we did on MAP, that is mapping antimicrobial resistance and use across 14 countries. It was a country research on antimicrobial resistance, and throughout this work, one of the critical things which we did, we evaluated large quantities of data in Africa. We collected data on lab as well as pharmacies, and critical on this, we saw that only 1.3% of microlab, they perform bacteriology testing. And this is really very low looking at the landscape which we have in Africa, as well as we also looked at a drug resistant index. As you can see down there, we also saw that 12 countries in Africa, their drug resistance index is above 50%, which is really a critical need to understand some of the critical challenges which we normally see on a daily basis in Africa. So across Africa as well, there are currently studies moving along, which, as you can see on the presentation, just to depict what is being done as one of the critical issues. Africa sees that antimicrobial resistance is as a critical issue, and it needs special focus. It needs special attention to be able to address these critical concerns. So getting into today's topic, I will just look at the importance of addressing AMR in Africa. The impact on public health cannot be overemphasized. As you know, there is an increasing mortality and morbidity rates. We have seen some studies which have been done across Malawi, Uganda, and Kenya, and Ghana, the work which has been done, which is still ongoing by Wellcome and Pfizer, and we can see dates reading to antimicrobial resistance. And from that work, we have also been able to see, or from the PPS work, which is happening across the countries, you can see that one of the critical impacts on AMR are longer hospitalization stays, as well as huge medical costs, as well as we have seen impact on our ecosystems, as well as disruption of our microbial ecosystems, as well as spread of resistance genes in the environment. That's why right now, one of the critical things we'd really want to focus on is the inclusion of critical, the One Health approach, inclusion really of the environment, because we are seeing resistant genes within the ecosystem, and it's something we really need to address with a lot of urgency. And when we talk about drivers, there are kind across Africa, there's so many drivers, but according to this discussion today, I only picked up two: inappropriate use of antimicrobials. This has been overemphasized. We have seen overprescription and misuse of medicines, both in human health and animal health. And this has been accelerated a lot because of lack of legislation, as well as safe medications, lack of awareness, propagating around the continent. And from the agricultural practices, we've seen also heavy use of antibiotics within livestock, and as well as aquaculture, and poor hygiene and lack of infection and prevention control as some of the critical drivers in Africa. I have picked up these because these are some of the things, when we look through them, initiatives we can be able to drive interventions to be able to control. So what are really some of the challenges we are seeing? Challenges, we've seen challenges of lack of access to quality health care. We have seen really insufficient healthcare infrastructure across Africa. When we put in on a daily basis, we haven't seen a lot of investment into diagnostics. We have not seen a lot of investments into treatment. We've not seen a lot of investments into medicines or antibiotics. We have very little drugs across the continent, as well as very, very few selection of drugs. And we have seen overburdening of access drugs being heavily used within the continent. When I talk about the lab infrastructure, it's very bad. We haven't seen a lot of investment into that. Even the infrastructure itself, the equipment, the service maintenance, we have not been able to see that investment pushed through to these laboratories across. I've just a small fraction because of maybe the Fleming Fund investment, but this is really a very small fraction of our resources we are seeing. So this really impacting a lot of quality healthcare within our systems across the continent. Hugely also is the poor infection prevention and control initiatives. There has been inadequate sanitation and hygiene in healthcare settings, limited IPC training resources, and even the investment into IPC. We have it just water and sanitation. We've not hand washing facilities. We've not been able to see such infrastructure, as well as investment tailored into these countries. When we talk about environmental factors, it's the same component which is linking also to IPC, contamination of water resources. You can see on the continent, especially in sub-Saharan Africa, we've been able to see huge cholera outbreaks. This is all because of water, poor sanitation, contaminated water across, and this keeps spreading throughout the ecosystem. As well as when we go to the facility level, you can be able to see that we do not have proper systems to discharge our waste, as well as the pharmaceutical products. So these are some of the challenges we see across in Africa. We have another issue to talk about now on climate change and AMR. There has been very little focus on linking climate change and AMR, impact of climate change on bacterial survival, alterations in the ecosystem. These are some of the things we critically need to focus, but we have not seen a lot of that coming out, even in studies, so that we can be able to depict what really impact is AMR on climate change. And so these are some of the things we keep seeing on every day. Socioeconomic factors, this is very evident, poverty and AMR. Limited access to clean water and sanitation with increased infections, poor living conditions, increasing susceptibility to infections. So these are increasingly some of the critical areas we see because of poverty levels, because of no water. We see increased infections and bacteria's resistance within our ecosystem. We have not propelled a lot within education and awareness. So there's still lack of awareness and AMR among the public. I clearly say every time that we need to engage the community to make sure that we have got dialogues, we have deliberative conversation, we have messages tailored to communities so that they can be able to understand what AMR is and what impact it is. I clearly say many times that AMR is not really a disease. It's as a result of special things which we've been doing, but we need to help communities realize what this is and how it is disrupting the communities as well as the increasing infections. So we really need to build up awareness materials, aware and campaign messaging so that communities are able to pick up community tailored messaging so that they are able to understand. So on public health impacts, the burden on health care system, this one I cannot overemphasize, is an increased strain on healthcare resources, challenges in treating resistant infections. We've not seen how we are able to bridge through to leverage on existing resources, leverage on existing burden like HIV, malaria, to leverage on AMR to make sure that we harmonize these efforts so that we do not have challenges in terms of looking for resources as well as investments. And we have challenges in treating resistant infections. We need to make sure that we tailor AMR infections within standard treatment guidelines or within the routine treatment guidelines which we have within the countries. And the impact on vulnerable populations is huge. There is a huge impact in children, in elderly, immunocompromised individuals. There are a number of things we can talk about within our immunocompromised individuals relating to HIV, to TB. We have seen overuse of medicines within the HIV space, misuse of antibiotics within our normal program tailored interventions. So there is a lot which we can really look through so that we can be able to bring in health impacts as well as leverage on existing programs, but integrating them in a manner that is consumable as well as it reflects situations as well as conditions in each of our populations. When we look down now into our ecosystem impact, we've got biodiversity loss. There's a lot of disruptions on natural microbial communities as well as wildlife and biodiversity. This is a space where we really need to look through how organisms, how resistant bacteria are spreading within the environment as well as the natural inhabitants. We really need to work on linkages within the ecosystem so that we can be able to tailor these pathogens as well as understand migrations as well as mutations into a very programmatic ecosystem network. Without that, we'll be failing. So we really need extensive studies to be able to understand the ecosystem, how bacterial genomes are moving into the natural inhabitants. When I talk about strategies on combating AMR, there are so many strategies. There's so many strategies, but I have just picked out a few which I think works with what we have right now. Number one is to strengthen the surveillance system. It's very critical for us to establish and implement very robust surveillance system which are harmonizing all areas, which are One Health tailored. So implementing robust AMR surveillance network is one of the critical components. Leave no area behind, whether it is AMR, is AMC, it is in aquaculture, we need to have a harmonized surveillance system which we can be able to link through the data, but as well as to understand the scenarios within each of the local context, as well as data sharing and regional collaboration. We need now in our data space as well as regional coordination so that we are able to understand. On two is rational emphasize a critical tool to monitor implementation as well as drug resistance as well as pathogen resistance. So promoting stewardship programs is a very critical. Policy action measures should be handled. Moving forward, we need to see our policies and legislation measures as well as the Hello?
Oh, we can hear you, Doc.
You can hear me?
Yes, we can, but we can't see your presentation again. Okay, fantastic.
Can you see my presentation? Sorry for that.
Yes, we can see.
Are you able to see my presentation?
Yes, we can see it. Please go on.
But as well as okay, thank you so much. So I was talking about our strategies in combating AMR.
She pushed off her video.
Yeah, so another strategy is our One Health approach. This is something which we have been talking about for long, but we need. Hello, Babatund, are you able to see me?
Yes, go on, please. We can see you.
Okay, wonderful. So I was talking about the multisectoral approach. One Health is one of the critical components which we need to focus is in my talk. It's not an area where we need to think thrice about it, but at a level where we are in moving forward to implement, we need to make sure that we are integrating all the sectors. Not only we've seen hugely focusing on health, we've not seen a lot of things on animal and environment, but our One Health approaches will be critical when will be critical and will move forward very well when there is greater collaboration across all the sectors, not only just on documents, but we need to see interventions. We need to see practicalities tailored at a One Health, tailored and harnessing all the areas. And another critical component, which I think it's very, very critical moving forward, is the community engagement, raising awareness, changing behavior. And these community engagements are tailored into local communities for AMR action. We need to make sure that we involve, even at the grassroots level, that there is proper understanding of the messaging, proper understanding of the issues, so that we can be able to make progress as well as impact. My last slide is just a call to action at the level where we are moving forward, looking ahead to the UNGA meetings and the discussions around UNGA. We need to urge one another to take action. It's not only just come together as One Health, but we need to put actionable interventions in place. Our policymakers, our healthcare professionals, our communities should come together to be able to take part in the fight, put resources, put interventions together, so that we can be able to strengthen and as well as mitigate challenges on antimicrobial resistance. Thank you so much, team, and over to you, Dr. Bobai.
Thank you very much, Dr. Watipaso, for that very interesting and educating presentation. You gave a very detailed presentation on AMR and went through the process of identifying the drivers, challenges, and even recommending solutions to address antimicrobial resistance in Africa. As a summary, you started with the issue of AMR and the importance for us to address AMR, stating clearly that, like we know, antimicrobial resistance is becoming a big issue, especially in Africa. And the issue of AMR is the drivers are many, but you listed two. The first one is inappropriate use of antimicrobials in Africa. A lot of antimicrobials and antibacterial are sold across counter in Africa, and you see people self-medication using antibiotics without doctor's prescription, without any form of medical knowledge. And you also talked about agricultural practices, especially in the animal sector and even in plant sector, people injecting poultry animals and domestic animals with different kinds of antibiotics and not waiting for the withdrawal period to sell the animal products out. And the impact of this is having on AMR on the continent. And you talked about the challenges. Talked about challenge of lack of access to quality health, for infection prevention and control, which is a very, very big issue on the continent in most countries in Africa. Environmental factors, the link between climate change and AMR, that's an emerging area that we should start studying. Poverty and AMR in Africa, human activities and the way people in rural areas behave and how it affects antimicrobial resistance on the continent. And you made a very specific statement that caught me. You said AMR is not a disease, but what we need to do to reduce the impact of AMR is education and awareness, educating relevant stakeholders on this huge challenge and creating awareness on the need for all of us to work together to change our behaviors, both the human health, animal health, and environmental health, coming together in a transdisciplinary way to see how we can adjust and change our response to us to effectively reduce the issue of antimicrobial resistance on the continent. Now, you said One Health approach is very important. Like you said, this is not just a human health issue. It is very important for us to look at AMR in a very transdisciplinary way, integrating human health, animal health, and our shared environments. And until we understand clearly the link between human, animal, and environmental health, and how this link to address, to impact antimicrobial resistance in Africa, it will be very difficult for us to effectively address it. So in addressing AMR, it's very important for us to use multi-sectoral approach, transdisciplinary approach, especially the One Health. And not, like you said, not just in reporting, but having a clear understanding of this link and working together for us to effectively address this very important and emerging challenge on the continent. So thank you very much, Dr. Watipaso. I'm very grateful for that very educative presentation by you. And also thank our participants. I can see we are already having questions on the question and answer section of the Zoom link. I'm sure a lot of questions will still be asked. You can go there and continue to ask your questions. And I want to say, as usual, after this webinar, we are going to share the presentations with participants if our presenters allow. And we're also going to share a certificate of participation with all our participants today after the presentation. Thank you very much for our participants. I can see people in the chat box putting their countries and their organizations. Please continue to do that. We've seen participants from different countries, Nigeria, Malawi, Kenya, United States of America. Please let's know where you're joining us from and go to the chat box and just say hi. I'm so from Malawi, from Madagascar, from India, wherever you're joining us from. Please let us know it. Without wasting our time, we'll go straight to the next presenter of today. And our next presenter today is no other person than Professor Mark Mendelsohn. He's a professor of infectious disease and head of division infectious disease and HIV medicine, University of Cape Town. Prof. Mark, his work has spanned clinical research and policy to mitigate antimicrobial resistance. He's a co-founder of South African Antibiotics Stewardship Program and chaired the South African Ministerial Advisory Committee on Antimicrobial Resistance between 2014 and 2022. He's a technical advisor and member of Scientific Advisory Committee for WHO, GERPD, and Vively AMR register. Prof. Mark, we're very happy to have you on our platform today. Please, you have the floor.
Thank you so much, and such a kind introduction. And it's wonderful to be able to join you. Thank you to everybody at GET for these wonderful webinars and this opportunity. So, and thank you too to Watipaso, who laid out beautifully an introduction into these issues. And I'm going to really take some of the points she made and flesh some of these issues out and try and think about innovative strategies and frameworks to be able to prevent, not to so much prevent, but to mitigate the increasing antibiotic resistance issue in Africa. And I am going to touch on occasion on other types of pathogens and resistance, but I am going to focus this talk on antibiotic resistance in bacteria. I have no conflicts of interest to declare that would stop me giving this talk. Now, as Watipaso has laid out beautifully, there's a hell of a lot of work to do. There are a lot of different interventions and areas that we need to think about on a One Health basis in antibiotic resistance. And really, each country's national action plan is based on a blueprint from the World Health Organization in 2015, the Global Action Plan. And you can see these buckets that were mentioned previously on awareness, on surveillance, research and development, stewardship, and etc. And if you just look at the South African, just for an example, you can see the same sort of areas. There are these pillars: diagnostic stewardship, surveillance, prevention. We all have the same thing. The problem is that we're trying to do everything, and that is holding us back from getting to where we can actually make a big difference. And I would say to you that the lack of prioritization in how we are mitigating the interventions we're trying to mitigate antibiotic resistance with is holding us back and causing a severe challenge. And if you ask me where your biggest bang for buck was on the policy sort of framework pyramid, it's infection prevention. And I'm not just talking about infection prevention and control in hospitals. I'm talking about infection prevention in its full form across human and animal and indeed environmental health. And I'll lay this out and go through each of these and try and just point out some of the innovative strategies and issues we need to deal with. And at the very heart of this, we're talking about antibiotic resistance, or if you want, antimicrobial resistance, which is a scientific construct. It's actually a microbiological construct. But at the heart of this lies effective access to sustainable access to effective antibiotics. And actually, each of these different areas, be it infection prevention, be it antibiotic administration, testing, surveillance, awareness and education, or research and development, we need to keep in mind at the heart of this how we improve access. And all of these have a role in increasing access to effective antibiotics in Africa. So I want to start with infection prevention, because my premise is that this is where you get the greatest bang for buck. And whether that's in clean water and safe sanitation, in hospitals, in IPC, on farms, this is the critical issue for me. Now, the evidence is mounting up. This is AMR, antibiotic resistance genes in sewage samples taken from different areas of the world. And as you can see, Africa has had the highest number of resistance genes per sample. And when you looked at the association, the correlation, it was with the Human Development Index. And the 3 out of the top 5 factors in the Human Development Index of a country relate to sanitation and water. The actual amount of overall antibiotic use, country-level antibiotic use, was not significantly associated. It's about the Human Development Index and safe water and clean water and safe sanitation. A second study looking at different countries, and again, which types of intervention actually improve things to the greatest benefit. It was the infrastructure index in this study, which was a composite of, as shown on the right-hand slide, of infrastructure, including adequate sanitation, improved water sources, etc. So again, we're pointing towards the issue of infection prevention. And we've just presented a series of papers in the Lancet on antibiotic resistance. And the modeling that was done has shown that with increasing infection prevention control in hospitals, using 20% increase in hand hygiene as the marker, universal access to WASH, and universal coverage of priority childhood vaccines, we can prevent 750,000 deaths per year that are associated with antibiotic resistance, which is about 18% of the entire amount. So this is really where you get bang for buck. On the farms, we know what we're meant to do. We know that we're needing to increase in agri-food production. It's about feeding practices. It's about design of the space. It's about hygiene, biosecurity on farms. It's costly, but it can be done. We've been asking antibiotics to do what infection prevention needs to do on farms for far too long, but we need to think about where the funding's coming from. And particularly as we increase our need for animal protein and climate change is increasing the loss of our agricultural areas for production, this becomes more and more important because it intensifies food production. So we have to make the financial investments into the agri-food industry in Africa if we're going to be able to get enough food for our population. And there's been a number of different areas where interventions to increase the potential for vaccination and WASH. This was a report from Gavi, the Vaccine Alliance, really laying out the 10 issues that need to be done, including that from Africa and countries themselves. We need to build manufacturing plants and industry capacity here on the continent, and we need to harmonize regulatory authorities, be able to predict what we need for supply chains, etc. And we need to upskill human resources. Similarly for WASH, if we want to get to the WASH SDG 6 target, we need innovative finance, and there are a variety of different options. You'll see airline ticket levies, which has been used in malaria before, but there are a number of different options because to get to SDG 6, it's going to cost 229 billion per year till 2030. In other words, for the next 6 years. So we need to generate income. From infection prevention, now what about expanding access to antibiotics in Africa? We know that still more children under 5 die of lack of access to an antibiotic than antibiotic resistance. So we've got these two areas, antibiotic access and antibiotic resistance, that we need to look at. And it's not just about procuring the amount of antibiotics we need, it's about how we deliver them to our citizens through our health systems. The model is broken if we try to hang on to only doctors and nurses prescribing antibiotics and being points of access to antibiotics. We know that there just are not enough doctors in Africa or nurses compared to the rest of the world to be able to have that system in place. Similarly, we do not have enough veterinarians for veterinarians to be the only prescribers. We need to move outside the box, and we need to stop vilifying informal sellers, be they pharmacists or medicine vendors or drug shops, and we need to start bringing them into the fold. So in England and Wales, now you can go to a pharmacist and you can get up to, for the 5 most common infections in the community, the pharmacist with regulations and with standard operating procedures and guidelines can actually give you antibiotics. You don't need to go to the doctor or the nurse. That needs to be transferred much more into Africa and other low middle income countries. But we need to give informal sellers and indeed doctors and nurses here in Africa better tools. Diagnostic uncertainty is the critical factor, one of the critical factors in the overprescription of antibiotics, particularly as fever is the most common sign of many infections, as you all know. And it's not just about bacterial resistance. Indeed, in malaria, we know that the introduction of malaria rapid diagnostic tests at point of care dramatically reduces unnecessary anti-malarial treatments, thereby reducing resistance, but it also increases antibiotic use because we don't have the rapid diagnostic tests to be able to say that there isn't a bacterial infection, or do we? Well, firstly, to say that point-of-care rapid diagnostic tests can be used by informal prescribers, in community healthcare workers, in drug shop vendors. In this Cochrane review showed that you are able effectively to use these rapid diagnostic tests to give appropriate treatment. But as I've said, it's not just about malaria, for which we do have a rapid diagnostic test. In Tanzania, this study in children presenting just with a fever showed that actually malaria was not the major issue. It was mainly viral upper respiratory tract infections and other issues, including some bacteria, but mainly viral infections. If you don't have the point of care tests, then it's to be able to tell you that you've got a virus versus a bacteria, we're going to continue to overuse antibiotics. There is a test, the C-reactive protein, which has been shown in this large Vietnamese study in 40,000 people getting antibiotics using the C-reactive protein point of care test, that you can safely withhold antibiotics for those that don't need it. And there are good economic considerations for combining malaria rapid diagnostic tests and C-reactive protein. So what actually we need is not more laboratories. What we need is rapid point of care diagnostic tests to be able to help manage infections at the community level. And in fact, the Longitude Prize just about a month ago named its winner, which is a new test which can be done at the bedside in the doctor's, in the clinic or the doctor's office, to be able to diagnose whether somebody has a urine infection and whether there's resistance to antibiotics. So more of this is needed, and this is where the change can be made to be able to support informal sellers who can then potentially provide access to antibiotics for people who are not able to access them at the moment. But we need a lot more investment. If you look at the investment in research and development, yellow is the diagnostic, blue is basic research, and therapeutics is the light pink. You'll see that the majority of money over the last years goes not to diagnostics or indeed vaccines, which is the green, but indeed to new therapeutics. And we've published studies on this policy framework on how we deliver sustainable antibiotic supplies Of course, there's multiple different areas that need to be looked at, but it's really a consortium effort, bringing in political commitments, developing economically viable models for new antibiotics, but also for old antibiotics and diagnostic tests, and of course, strengthening supply chains and fostering partnerships. So what about surveillance? We've heard from Watipaso about surveillance, whether it's surveillance in terms of antibiotic use in humans, animal, pets, or for agri-food industry or in the environment, whether it's resistance profiles across all of these, or indeed whether it's the quality of medicines. Now, the UK Fleming Fund has supported laboratory strengthening and capacity in Africa, and that's improved surveillance data, which is being reported to the global antimicrobial resistance and surveillance system. But unfortunately, the glass is half full, because not only is the data from the laboratories actually not complete, but we're not picking up all of those infections and antibiotic use, as I've mentioned, not only in humans, but also in the animal sector. So we need innovation in our strategies for surveillance data, and the Trinity Challenge, which I'm directing at the moment, have had winners in both their challenges, which use cell phones to be able to develop and to collect antibiotic surveillance data in animals and in the agri-food industry. That needs to be increased in our innovation. Also, innovation in the field of antibiotic quality, because of course that impacts not only on cure, but on resistance. And this series of papers in 2021 field tested a number of different potential quality assurance, quality of the antibiotic to try and weed out substandard and falsified medicines. None of them are perfect, but there needs to be greater innovation to allow us to help prescribers and dispensers of antibiotics know that they're giving the right things. And of course, we need integration of One Health systems, because we don't have the money to do separate for human and animal and environment. We need to develop that integration system so that we can perform better surveillance. We also need to rethink communication and awareness. As Watipaso said, we need to get to the community particularly. We are using terminology which has been known for decades now to be absolutely useless. You and I might know what antimicrobial resistance is, but go to anybody in the street and it's highly likely they do not understand it. We have a language problem and we're not doing anything about it. Part of that is because at a high political level, it's been adopted, but that's not what we're aiming for. What we're aiming for is behavior change that will actually make an impact. And if people don't understand what you're talking about and don't receive the knowledge in a way that is trusted and will make behavior change, then we're still going to be talking about this in 20 years' time, and it's going to be far worse. We also need to change the way we talk about antibiotic resistance. I said it's a microbiological construct, but we are symbionts. We are more bacterial cells than we are humans. And we need to understand that we are developing and causing an ecological disaster, just as we are in climate change. While this koala has no trees left because of the decimation of the environment, the ecological decimation of the bacteria in and on our bodies and in animals in and on their bodies is causing serious issues. And we need to start communicating that in a better way. We need to change this from a war rhetoric, which is completely useless and actually contrary to the issue, because if you create war against somebody and threat, you use weapons, which are antibiotics, which are going to increase resistance. So we need to change the narrative. We need to start loving our bacteria. We need to amplify this issue of risk in misuse of antibiotics, because it has associations with illness away from antibiotic resistance and infection. There's a link with obesity. There are links with neurocognitive disorders. There are links with allergy in people who have used antibiotics. And there's a link with the production of the development of inflammatory bowel disease. That isn't yet talked about. We're all talking about resistance. We're not talking about the impact in other ways. We need to communicate better, not just through the media that we communicate at the moment. This is a musical, The Mold That Changed the World, from the Fleming Initiative, the Fleming Fund, which is being seen around the world. It's a way of using what we might say more traditional methods of communication for Africa, not just word, but through song and through dance and through folk and all the indigenous ways that we communicate and that we have trusted knowledge imparted. In South America, REACT South America put on a whole day where song, dance, etc. was used to communicate antibiotic resistance issues. Lastly, on communication, we need to build a true civil society to communicate. In HIV, the Treatment Action Campaign in South Africa was a true civil society of the people. We are not getting that at the moment. We have civil society, but they're generally NGOs that support governments and national action plans. It's not society. We need to find ways to build a group of international society that is affected by antibiotic resistance and will champion it, including influencers. In terms of research and development, and I'm just coming to near the end of this talk now, we need to shift the discussion of R&D towards Africa's needs. The investment in antibiotic resistance is much less than in malaria, TB, and HIV, yet the deaths are far greater with antibiotic resistance than they are from any of these. So there needs to be a shift. The global market is advantages and is focused towards the global north, not towards Africa. And it's largely being driven at the moment by the WHO's priority pathogen list, which puts the critical group of bacteria that need more investment as the bacteria that you would see in intensive care units, in hospitals. That's a tiny, tiny fraction of what we actually need. And we need a much more public health and community-based understanding. The priority pathogen list, which is shown on the left from the WHO, looks very different to me from the one on the right, which is what I would say perhaps is a more realistic need for research and development for some African countries. Neisseria gonorrhea resistance threatens HIV, not just gonorrhea, but threatens HIV because we increase transmission of HIV when we have untreatable infections of the genitourinary tract. So we need to go more towards, for Africa, towards what we actually need. We don't need a new antibiotic for a Acinetobacter baumannii in an ICU. We need, on a programmatic scale, antibiotics for us. Lastly, governance. The G7 and the G20, the higher global north predominant countries, are pushing the agenda and are leading the agenda. It's mainly around pipeline investment for new antibiotics, financial incentives, and for the G20, a bit more about emergency prevention and preparedness. Everything is necessary, but where is the voice of the G77, the people that are meant to represent us? It's silent, has been silent since 2017. They've only just come out with a short process about the upcoming UN General Assembly. But we need our leaders to step up and actually take responsibility and drive this. And we've again published a paper recently about what we feel that the G77 need to do around leveraging new funding opportunities with the World Bank, for example, and regional banking systems, the focus on infection prevention, the ensuring equity and integration of AMR into the Sustainable Development Goals. The pandemic instrument, AMR or antibiotic resistance, can be integrated with it, but I worry that it will just get lost because actually this pandemic instrument is far more related to epidemics and pandemics, which are very accelerated and quick, and much less to a slow burning pandemic like antibiotic resistance. And what of the high-level meeting in September? Well, we need 4 things from a successful declaration: political will, well, there's political interest. I've talked about funding, accountability, I'll come to, and targets. Accountability, there is the hope for an independent scientific body, but that has to be independent. So far, the United Kingdom and Saudi Arabia have pledged money for this independent scientific body. We need to police this to ensure that it remains independent and that it talks to Africa's needs. Targets to mitigate, we need targets because we need to set a benchmark, not national targets, but global targets, which countries, like with climate change, can adopt and can work towards to benefit and to get us towards these targets. And of all of these targets, in the political declaration that will come out in UNGA, only a 10% reduction has been integrated into that declaration. It's a start, but it's not what we were hoping for. So our key messages to wrap up: access needs to be at the heart of antibiotic resistance and everything we do. We need to prioritize, otherwise we're going to fail miserably, continue to fail miserably. Infection prevention is where the bang for buck comes, a return for investment. The communication needs to be reframed and needs to be realigned to traditional forms of receiving information to change behavior in Africa and elsewhere, be it context specific in Asia or in South America. And the G77 needs to get off their seats and actually do something. And lastly, the independence of scientific panel has got to be ensured. And with that, I thank you for listening.
Thank you very much, Prof. Mark, for that very educating presentation and so detailed, gave an overview of strategies and policy frameworks for AMR prevention and control in Africa. And that was very detailed, going from, you actually touched the different aspects or you gave recommendation to different stakeholders involved in AMR prevention and control, from research to governance to day-to-day people, to governance within and outside. And that is a well-detailed transdisciplinary presentation that, regardless of stakeholder or your impacts or the role you're playing in AMR prevention and control, you surely gain from your presentation, whether you're an NGO or you're a policymaker or you're a researcher or you're just a day-to-day African. Thank you for that presentation. You started with Global Action Plan, and you talked about prioritization, the need for us to prioritize AMR as one of the big issues, health issues on the continent. And we talked about some key interventions, IPC, infection prevention and control, very important for us to address AMR on the continent. And when you talk about IPC, it's not just IPC in the hospitals, IPC in our environment and our day-to-day activities, the water we drink, the food we eat, the way we relate with our environment. And if we can adjust that will have a very significant, it will play a very significant role in reducing infection on the continent. You talked about importance of improved active access to antibiotics on the continent. Very important for us to have access to, and to create strategic approach for having access to antibiotics on the continent, not just limiting access to some people, but bringing all stakeholders in and create a well innovative approach to having access to quality antibiotics on the continent. And you give examples of different studies you've done in the area of access, in the area of policies and different areas. And you also emphasize the importance of WASH in AMR prevention, and talked about a lot of things, gave increase to access to test, especially rapid test diagnostics, just increasing testing on the continent. There's not just testing in the hospitals, but rapid test diagnostics. And with this, it will be easy for us to be able to identify whether a disease is an infection and prevent misuse of antibacterial or antibiotics on the continent. And I talked about policy interventions, made some recommendations at the national level, at the regional level, and the need for us to rethink our awareness creation and communication, the way we create awareness and communicate the AMR issue. And Africa has to look for indigenous solutions to address the AMR problem that is affecting us as a continent. And we should stop seeing bacteria as enemy, because we have more bacteria actually than we have more humans in the world. And we should have a strategic way of looking at addressing these issues and understanding the bacterial community or the bacterial world, and shifting research and development towards what Africa needs. That is very important. What do we need in Africa? Death in AMR as a result of AMR in Africa is higher than deaths from HIV/AIDS and other diseases that we're concentrating on. So there's need for us to increase funding and increase research and shift research and development activities towards research in the area of antimicrobial resistance and how to solve such issues. And you gave some key recommendations, both for the international government, for government at the international level, at the regional level, and at the continental level. So that was a very, very educating presentation. I'm sure our participants want to go over it over and over again to have a deeper understanding of your presentation. I myself, I have to review and re-listen to your presentation so that I can effectively digest it. And like you said, it's also important for us to start building civil society organizations that will play significant roles, especially in communication and awareness creation on AMR issues and AMR-related activities. And our organization, Global Emerging Pathogens Treatment Consortium, we're trying to play a leading front in that area, and we'll continue to work with other civil society organizations and other partners to see how we can contribute to creating awareness and even research in the area of antimicrobial resistance in Africa. So thank you again for that presentation. I'm sure our participants will have a whole lot of questions to ask, and I'm sure there will be some questions already on the question and answer button on the platform. You can go through it, and if there are questions for you, you can start responding to the questions as we continue the webinar. So without wasting much time, I'll go to our next speaker. She's the last speaker, but she's not the least. I'll give a short introduction and hand over the platform to her to give her presentation. Our next speaker is Ms. Fauzia Mohamed Sheikh. She's the AMR Focal Point African Center for Disease Control and Prevention. Ms. Fauzia is a global public health and development specialist leading the implementation of the African Union AMR framework. As the AMR portfolio lead at the African CDC, she provides strategic and technical support to African Union states, driving initiatives to combat antimicrobial resistance across the continent. Thank you very much, Ms. Fauzia, for joining us today, and please, you have the floor.
Thank you so much. Yeah, please share my slides. It's in a presentation mode, please. Okay. Thank you so much once again for inviting us, Africa CDC, to this webinar, and also giving us the opportunity to share with you some of the work that we do at Africa CDC. I think our topic is to discuss a little bit more on the strategic response to combat antimicrobial resistance in the African continent, and I am happy to provide some sort of like an overview of the challenges that we're experiencing at the continental level, and also some of the strategies that we are employing, including closely working with all our partners and all our AU member state countries in mitigating antimicrobial resistance. So AMR is such a complex issue. You've seen from the two previous presentations, everything that has been said about antimicrobial resistance, which includes significant risk to global health, our economy, taking us steps back, including the progress that we've made in the modern medicine, also increasing mortality rate. We are currently documenting millions of deaths in the African continent, which is projected to be more by 2025 if unchecked. Also considering the economic impact the AMR is having in the African continent, and some of these issues are not really addressed or given priority, especially at a national level. So resistant bacteria also cross borders. This means we require a unified international response, not just like countries or partners working in silos. So we need some sort of like a continental strategy to see how best we can approach this and how best we can mobilize all resources in a coordinated manner and in multi-sectoral approach. AMR, I'll just provide a brief overview on this slide. This is a leading public health threat of the 21st century. And in 2019, nearly 1.27 million deaths globally were attributed to antimicrobial resistance bacterial infection. And based on a study conducted by the University of Washington, Africa has the highest mortality rate from AMR infections in the world, with 24 deaths per 100,000. And also the growing threat poses major threat to progress made in health and the attainment of African Union agenda as well. So this challenge is is just due to the current estimate of AMR are based on poor data foundation in low middle income countries, especially in the African continent, due to our fragmented surveillance system and also lack of like quality data from the African continent, which informs policies at the regional level. Next slide, please. Oh, thank you so much. So just taking a closer look at the impact of AMR in sub-Saharan Africa, I just wanted to share a bit of a snapshot. In 2019, Western Sub-Saharan Africa carried the highest burden of death attributable to AMR, with a staggering rate of 2.73 deaths per 100,000 people. So this data underscores the critical need for targeted intervention in the region to combat this growing threat. And as you can see from the other regions, they are close to what has been reported from the Western Sub-Saharan Africa as well. Some of the contributing factors to the high burden of antimicrobial resistance include inadequate healthcare infrastructure, limited availability of antibiotics. I think that has been mentioned by the previous presenter as well, which are effective and appropriate, can lead to use of substandard drugs that foster resistance. Also, the circulation of falsified drugs in the African continent right now due to weak regulatory systems also contribute to the high burden of antimicrobial resistance in the continent. Also, surveillance and data gaps, which hampers the understanding of the AMR trends and the effectiveness of some of these interventions. Next slide, please. So next slide. Yeah, so here I just wanted to share with you, despite some of the significant progress that we've made in the past few years, with around 80% of African countries having developed or began implementing their national action plans on AMR, a critical challenge which remains is the persistent lack of funding. And this also has been mentioned by the previous presenters. So this financial gap threatens the sustainability and effectiveness of these crucial efforts. For example, in 2023, you can see from the pictorials, 45 African countries had AMR national action plans in place, but none report financial provision for the implementation in national plans and also budget. So this actually hinders the work or the progress that we want to see in the African continent in regards to implementing their national action plans, or in allocating budgets, for example, at a national level dedicated for the antimicrobial resistance. Most of the fundings come from outside. So having a dedicated national budget at the national level is very important for sustainability purposes, considering most of the support coming outside are mostly project-based. So at Africa CDC, we are trying to see now how best we can advocate for more resource mobilization at a country level, and also advocating for more involvement of the policymakers so that they can also understand that this is one of the biggest threats, which is really which is not often discussed or often given much attention in the healthcare sector. Next slide, please. So here, I just wanted to share with you at Africa CDC, the AMR program. It started, I think, a year after Africa CDC was established, and our strategic goal is to reduce the burden of AMR on the continent by strengthening targeted prevention and control efforts. So this is one of the strategic goals that is guiding the program at Africa CDC level. Next slide, please. So we're trying to take a proactive strategic approach to address the growing challenge of antimicrobial resistance across the continent. And our response is grounded in some strategic pillars that aims to enhance capacities, foster collaborations, and drive sustainability, sustainable impact. This includes enhancing lab capacity and also strengthening the national AMR surveillance systems, strengthening also the infection prevention controls and the biosecurity, promoting advocacy and awareness at all levels, including involvement of young people in being the change agents that we really want to see in the African continent. One of the key things that we currently working on is involving young people and also the civil society organizations in our advocacy and awareness initiatives at the continent. Also fostering cross-sectoral collaboration. This is the One Health approach. I'll mention in my next slide. And also developing and implementing policy frameworks that will guide the African continent. It also all provides some guidance to the African continent in how we are mitigating the AMR threat. Next slide, please. So here I just wanted to mention that as we continue to address this complex health challenge, it's also crucial to refine and adapt our One Health approach. So at Africa CDC, AMR sits in the One Health unit, which is about to be a division right now. And these are other programs that have been part of the One Health priorities at Africa CDC, including the genetic diseases, climate change, food safety and security. All these are interconnected in one way or the other. And we aim to redefine our One Health priorities to better integrate human, animal, and environmental health, ensuring a holistic and resilient response to the current and emerging threats in the African continent. Next slide, please. So here, I just wanted to mention about the high political commitment or buy-in that we have for the AMR in the African continent. So in response to this escalating threat of AMR, the African Union has endorsed these commitments through the Assembly and declared the African Common Position, endorsed the African Common Position on AMR, and the Africa also subsequently supported the launch of the African Union Framework for Antimicrobial Resistance. So the establishment of the African Union Framework for AMR control, which is a comprehensive strategy, was designed to guide member states in their effort to combat AMR at both national and regional levels. AMR also being considered as a global risk beyond the capacity of any organization or nation. It needs a holistic approach. So African Union does advocate for interagency approach to AMR activities in the African continent. And what does this mean also for the African countries or for the head of states and government is to advocate for more resource mobilization and also to show the commitment that we have at the head of states and government level in supporting the AMR agenda in the African continent. Next slide, please. So subsequently, the African Union Task Force on AMR was established. I just wanted to mention this just to show the work that we are doing at Africa CDC level, or generally at an AU level, which, and this task force was mainly to coordinate the AMR control within the AUC, the African Union Commission, sorry. This joint secretariat is led by Africa CDC and our sister organization, AU-IBER. And we closely work together in monitoring the progress in achieving the objectives of the AU framework for AMR control. Next slide, please. So just to mention also our unique position as a continental institution that has been mandated to safeguard the health of the continent. Africa CDC is uniquely placed as an autonomous technical institution of the Africa Union Commission. So that means we leverage our political strength and use this unique political position on the continent to raise more awareness, convene high political meetings, for example, for policymakers, for ministers of health, secure commitments, influence policy at the head of state level for One Health approach and mitigating antimicrobial resistance. So this also gives an opportunity to inform the policymakers of the threat of antimicrobial resistance, and also seek more commitment and more support, and also create bring more awareness, to the table to make sure this is really well articulated and captured. Next slide. Yeah, so I just also wanted to highlight some of the, as part of our commitment to combating AMR, some of the strategies and some of the strategic and technical documents that we developed. Africa CDC developed a range of strategic and technical documents. So these resources provide critical guidance. This includes the framework. We have the IPC legal framework. We also have we also have the African antibiotic treatment guidelines for common bacterial infections, the African for neonates and also for the adults. So these documents help to align efforts, implement best practices, and also drive impactful action against antimicrobial resistance across the African continent. Also, this gives us the opportunity to harmonize the existing strategic and technical documents across the continent and make sure that we are all speaking the same language when it comes to AMR. Next slide, please. So in Africa, as Africa CDC, we aim to promote collaborative and multi-sectoral approach to public health threats. And this means recognizing the interconnectedness of all these sectors. So some of our primary aim, which is clearly stipulated in the African Union framework, which guides the African member state countries, include the improvement of antimicrobial resistance. This is strengthening the AMR surveillance system, supporting the implementation of antimicrobial stewardship programs at the national level, increasing the proportion of healthcare facilities implementing infection prevention control. One of the key documents that I've mentioned was the IPC legal framework, where some of our AU member state countries are currently domesticating, also increasing the number of healthcare facilities with quality diagnostic tests for infection and also for antimicrobial resistance. This is through building capacities for microbiology laboratories, and also mapping out the critical gaps existing in our microbiology laboratories, and trying to see how best we can build a capacity for the workforce, including trainings and providing reagents, coming up with protocols. So all that, these are some of the primary goals that we have in supporting the AU member state countries. Next slide, please. So I think this has been spoken about, but this is one of the projects that was done in support of Africa CDC for the AU member state countries with support from Fleming Fund. I think Dr. Atipas also mentioned at some point as ASLM being the key implementing partners. This was to support 14 AU member state countries build capacity for the microbiology laboratories and also collect large quantities of data for the very first time in the African continent. So this map findings highlighted only 5 of the 15 antibiotic resistance pathogens prioritized by the World Health Organization were found to be consistently tested across the 14 countries. And only 1.3% of biology laboratories in Africa perform bacteriology testing needed to detect and better understand antibiotics. So this shows the critical need to scale the capacity. Also considering that the participating countries were only 14, Africa CDC now has to also scale it up to the rest of the African countries and also mobilize more resources and bring in more stakeholders and build capacity in that regard, because I think based on the data that was shared from some of these countries, you can see how critical it is and how underreporting of the AMR, the resistance pathogens, are in the African continent. So we need a way of approaching this and making sure countries, when we establish our AMR surveillance network, for example, for the continent, we are collecting data, quality data, assessing, analyzing, and finally also documenting so that it can inform policies both at a continental level, also support countries in making decisions at a national level. So we're having challenges still when it comes to AMR surveillance at a national level. So one of the key objectives, I think, for Africa CDC right now is to closely work with all our technical partners, our developmental partners, funders, in supporting the AU member state countries in strengthening the AMR surveillance system. Next slide, please. So in this slide, just wanted to mention this project was launched, and the data from the 14 countries, each individual country report was also published, and now I think they're opening up for the second phase of this particular project, which I'm looking forward to. Next slide, please. So these are some of the in-country support that we provided. For example, Ethiopia being one of the Centers for Excellence for AMR, we supported them in strengthening the AMR surveillance, in reviewing this AMR surveillance plan last year and also this year. And this is one of our capacity building efforts in strengthening the surveillance system, while also reviewing the countries, the progress the countries are making in the AMR surveillance system. Next slide, please. So also this was for Zambia, one of the technical support that we provided in strengthening the AMR surveillance, and also Africa CDC hosted a domestication workshop for the country on the AMR lab scorecard in 2023. And the aim was to achieve the vision of the Africa CDC framework that proposes a network of accredited human and animal microbiology laboratories across the African continent. And also the technical meeting brought together representatives from all the sectors. So this is also us advocating for a One Health approach in AMR. Next slide, please. Next slide. Next slide. Hello, next slide, please. Yeah, so this is also one of the initiatives Africa CDC has undertaken. One of the strategic activities that we've done is launching the international exchange visit on, sorry, please, the previous slide. The international, no. Please go back to the international exchange visit. Next. Yeah, thank you. So thank you so much. So I just also wanted to highlight this initiative by Africa CDC, which is currently being supported for AU, which is being facilitated by Africa CDC for AU member state countries. And I think what prompted the international exchange visit was just to learn best practice within the African countries. We were trying to use the limited resources that we have in the African countries. For example, I know NICD of South Africa is one of the centers of excellence for Africa CDC. And so far, two countries, the Republic of Zimbabwe and the Federal Democratic Republic of Ethiopia, both benefited from this exchange visit. And participants share their best practices for establishing and operationalizing functional laboratory-based antimicrobial resistance. This is a 5-day program. And we are currently trying to see how we make it regional based so that African countries can really learn from one another in how they are implementing the AMR surveillance system. Next slide, please. Also, this is one of the strategic document that we are developing right now, roadmap and implementation strategy for genomic surveillance of antimicrobial resistance. This document will be launched this year. It's still currently being validated. And the aim of this is to create a comprehensive roadmap that offers guidelines and strategies for the effective implementation of genomic surveillance of AMR. Also considering that this plays a role in tracking and addressing AMR in the African continent. So some of the overarching aim of this roadmap is to provide guidelines for the implementation of genomic surveillance in Africa, which includes defining and streamlining a rational approach to genomic surveillance, providing a template for prioritization and selection of use cases for genomic surveillance, and also providing recommendations for capacity development areas to enable. So once we launch this document, we are looking forward to supporting AU member state countries in implementing them, and actually using them. So this is one of also our initiative in supporting stewardship programs. We conducted a review meeting for the existing stewardship guidelines at a regional level for Eastern and Southern African countries. Then after that, the regional guidance for the establishment and implementation of antimicrobial stewardship program was developed, which was validated and launched by the countries involved in this initiative. And we also established the community of practice for antimicrobial resistance after that. Next slide, please. So I just wanted to just a highlight of one of the support that we provided to South Sudan in developing their costed national action plan. I really don't want to go into details, but this is one of the technical support that we do provided to the AU member state. And this was development, but we also support the implementation to other countries in AU. Thanks. Next slide, please. So as part of our strategies, also engaging the civil society and youth, I think at some point I have mentioned, and the reason why this is also big for Africa CDC is to approach this whole mitigation of antimicrobial resistance holistically. So it's not about just technical support and surveillance strengthening, sometimes also engaging the young people who are working at the community level and creating awareness and having this innovative approach to support their communities, to make them aware of the harm, to how best to use the antimicrobials. For us, we try as much as we can also to make sure that these people are engaged and also given the rightful guidance, build capacity for them so that they can replicate the same to their communities. And we are so happy to say that we've engaged young people across the African continent in so many different ways. One of them was the AMR advocacy contest where they were submitting some innovative, I don't know what to say, pictures, just to describe the work that they're doing at the community level. Also, we established the African Youth Task Force on AMR as well, which is currently being supported by both REACT Africa and Africa CDC. Besides that, we also do support the training of AU media fellows on AMR awareness. Next slide, please. So every year we mark also the Continental AMR Awareness Week, and organized by the African Union and the United Nations Quadripartite. And I think the main highlight is just to engage various stakeholders in AMR awareness and action. For example, you can see last year we did media sensitization to raise awareness and increase media coverage of AMR issues. provide briefings, share key findings, engage media representative in discussion, also bringing young people from the universities to foster academic discussion on collaboration and antimicrobial resistance and use as well. Also hosting a structured debate and interactive sessions with the university student and faculty, and also awarding them the winners. All this initiative just shows the approach that we are taking in addressing AMR in the African continent. So we're trying not to leave any sector or any group behind. Everyone has to be engaged, everyone has to be on board. And we aim to educate, engage young audiences on AMR, host workshops, interactive sessions, especially online webinars. Try to also come up with educational materials for them in a One Health multi-sectoral collaboration, a One Health, approach through the One Health framework of Africa CDC. Next slide, please. So this is still a snapshot from the previous years. Next slide, please. So I also wanted to highlight, as Africa Union, one of the things that they have done this year, was to develop a continental landmark report on antimicrobial resistance through consultative process with technical experts, our partners, AU member state countries. And this document was launched 2 weeks ago in Africa, in HQ. And this particular report was supposed to present Africa's position on AMR through the and drive support from government and funders. Next slide, please. So I just wanted to highlight the key objectives of this landmark report, because at some point we've mentioned the United Nations General Assembly high-level meeting on AMR, which is very critical for the African continent, considering that the last time we had a similar high-level meeting at UNGA was 2016. And this year we tried to approach this from a point of like sharing both the progress that we've made, driving the conversations, our agenda, what is our agenda, what are our priorities? Are our priorities really accommodated at the high-level meetings? So some of the key objectives of the landmark report was to elevate the African priorities on AMR, recommend concrete actions in the African context, build political will to stimulate funding opportunities, strengthen the African Union's position to advance multi-stakeholder initiatives. So these are some of the key objectives of the landmark report. Next slide, please. Some of the objectives have been categorized into long-term and short-term, including addressing AMR drivers in the African context, building evidence and improving reporting, mobilize and coordinate resources by securing the financial resources and technical capability amongst key stakeholders to lead the AMR response in Africa. Next slide, please. So I would like to conclude, because I think the whole presentation was about the strategies Africa CDC is using in combating AMR. So this slide just illustrates the significant impact of the African Union's initiatives on AMR through a series of strategic actions, coordinated efforts. These initiatives have catalyzed positive changes across various sectors. You can see from the launch of the AU framework to the establishment of the task force, to the AU member state endorsement of the African Common Position on AMR, to the development of framework again for the AMR Control 2020 to 2025, to the AU released antibiotic treatment guidelines, to the establishment of the interagency group on One Health. So from policy development to capacity building, this has enhanced public awareness and multi-sectoral collaboration, and does also help Africa CDC and generally the bigger African Union in having a unified voices in strengthening our AMR capacities in the African continent. So some of the strategies also fostered outcomes that benefit the entire ecosystem. And you can see this include the call to action on AMR in 2021. The AU launched AMR surveillance network, I think I mentioned at some point, which we are currently working on, and also trainings and capacity building efforts that the African Union has undertaken since the launch of the African Union framework for AMR. Next slide, please. So as a parting short, next slide. I just want to, just a passing short, this slide just emphasize on what we've discussed so far today. African priorities being underrepresented and in AMR strategies at a global level. Existing initiatives target the drivers, which accelerate progress, requires defined plans to improve evidence and reporting, supported by the mobilization and coordination of resources. That has also been mentioned in the previous presentation. This is something that will be echoed, reiterated, said every other time, but I think we need action right now. We have to move from discussions in boardrooms and developing strategy to actually getting to the work and making sure we are recording tangible results from the efforts that we are putting into the work that we do. So 80% of African countries have developed AMR NAP. This we already mentioned, but what are we doing about it as a continental body? And generally, every other person that is involved in AMR mitigation or generally in the AMR space, what are we doing? How are we supporting best our African countries, our countries at the national level, at the regional level, at whatever, at the facility level, because every effort matters. And so as I conclude, I would like to say that in as much as we try to employ as many strategies as we can in combating antimicrobial resistance, we need a coordinated effort. We need to come together as a community of, let me say, that are in AMR space. We need to strengthen the AMR surveillance system. We have to support the implementation or development of the antimicrobial stewardship programs at the country level. And we have to closely work together in creating awareness and building that synergy and momentum, because AMR at the end of the day affects each and every person, whatever they are, wherever they are, at whatever age. So thank you so much once again. And I think that is the end of my presentation.
Thank you very much for that very interesting and educative presentation. And thank you for giving a very detailed overview of what the African CDC is doing as regards to antimicrobial resistance. It showed clearly that the African CDC is playing a very leading role in addressing AMR in Africa. And you showed clearly that there are many interventions, or there are interventions in different African countries, from South Sudan to Ethiopia and to Kenya and other countries. It showed clearly, and Zambia, it showed that at least there's a collaboration at the national and regional level. And we sincerely hope that this collaboration will continue to expand and more organizations, both non-governmental organizations and governmental organizations, will be involved in the activities of African CDC in combating AMR on the continent. You started with an overview of AMR in Africa and what's the challenge of AMR in Africa as a leading challenge, and needs a collaborative effort for us to effectively address it. About 80% of African countries have developed and they are implementing their NAPs. And that shows clearly that at least we're moving in a positive direction on the continent. If you have 80% that have a strategy, AMR strategy on the continent, and we also have some countries that are implementing it. You talked about African CDC strategies to respond to AMR. You talked about enhancing laboratory and surveillance capacity, strengthening infectious disease and biosecurity and other strategies. You talked about redefining One Health priorities at African CDC, understanding the link between, like the other speakers have said, the link between human health, animal health, and shared environment, and they need to work together to address this emerging challenge on the continent. It is clear that we can work in silos, and integrating different sources of knowledge and different experts coming together is very important for us to address antimicrobial resistance challenge on the continent. We talked about the African Common Position on AMR and the African Union framework for AMR control. You also talked about the African Union Task Force on AMR and the several activities that your organization, the African CDC, is doing, and also collaborating with other countries within the continent to do. Talked about the African Union framework for AMR, and the primary goals that include improve AMR and AMR surveillance, delay the emergence of AMR, limit transmission, mitigate harm, and other primary goals. And your in-country support for Ethiopia, for Zambia, for South Sudan, and strengthening laboratory activities and connecting different countries together to understand laboratory, the effective use of the labs in addressing antimicrobial resistance on the continent. And I talked about international exchange visits in labs based on AMR surveillance system, support for South Sudan, and very importantly, talk about the civil society and youth engagements, which is very important. The civil society organizations have a very strong role to play in addressing antimicrobial resistance on the continent, especially in the area of awareness creation, communication, and even going into the communities, create awareness about antimicrobial resistance. And we can overemphasize the importance of youth on the continent. Over 70% of the population of Africa is below the age of 40. So we have, the youth have a very significant role to play in addressing AMR on the continent. And I strongly hope that the African CDC will expand their reach to more civil society organizations and even more youth. I'm sure there are a lot of youth on the platform. A big question in their mind is, how do I get involved in all this wonderful work African CDC is doing? And I'm sure our presenter will be able to answer that, because she herself is a youth, a very vibrant youth on the continent, doing a fantastic job in the area of antimicrobial resistance. So thank you very much for that presentation. You talked about key objective of what AMR, key objective of the landmark of what African CDC is doing. And you talked about many other fantastic work that your organization is doing. Thank you very much for that presentation. Like I said, one of the take home I get from the three presentation is collaboration. We can't afford to work in silo. Addressing AMR need a very transdisciplinary approach, integrating various sources of knowledge to address this very big and emerging challenge on the continent. Researchers cannot do it alone. Policymakers have a strong role to play, and so does the non-governmental organizations and even the day-to-day African on the road. We have to create more awareness and communicate in a better and different way. We have to look for ways to communicate to day-to-day Africans to understand that it's very important for them to change their belief system, their approach, and the way of doing things for us to at least limit and mitigate antimicrobial resistance on the continent. So thank you very much to our presenters. I've learned so much from your presentations. We really appreciate your wealth of knowledge and your expertise on the subject matter today. And I'm sure we have our participants I've learned so much from your presentations. Today, we've had about 250 participants on this webinar, excuse me, from over 30 different countries, and most of them have stayed with us in the last 2 hours. I want to say a very big thank you to our participants. Like I always say, you are the reason why we do this every month, and it's because our participants are increasing and they're engaging us both during the webinars and after the webinars. That's why we are always really excited to organize this online program. So thank you very much to our participants. And like I said, we're going to share the presentations, the PowerPoints with the participants at the end of the program. We also have the recordings on our YouTube channel. You can listen to it again and again and learn more. And I'm sure we can continue these conversations with our presenters. They're always willing to engage as many people that are willing to talk to them on the subject matter. So thank you very much from GET. We sincerely appreciate your participation. And before we go, a summary of our activities in GET. One of the things we'll do in GET is a GET journal. We have a GET journal of One Health and Biosecurity, which is one of the first African-based journal about security on the continent. One of the biggest challenges we have in Africa is contribution to research. Africa contributes just about 1% to research publication in the world. And that is one of the reasons why GET, being a leading biosecurity think tank on the continent, I've decided to launch a journal of biosecurity and One Health. The journal was launched about 3 years ago. Publication and submission for Africans is totally free. But what we'll do is that we'll publish the best of the best research on the continent and publication, and it's open access. So for African researchers that are willing to publish their original manuscripts, the GET Journal of One Health and Biosecurity is a platform that you can maximize. You can check us on the journal website, www.getjournal.org. We also have different other publishing platforms. We have the GET policy brief series, and we also publish the GET technical paper. One other important activity that will be coming up later this year from June 6th to 8th in Lagos, Nigeria, is the annual GET Conference on One Health and Biosecurity. It has grown over the years to become one of the biggest platform for One Health and biosecurity discussion in Africa. The conference has been organized in different cities in Africa in the last 10 years, and we'll be celebrating our 10th anniversary in Lagos, Nigeria in November this year from the 6th to 8th November. Everybody is invited. It's, like I said, one of the biggest biosecurity and One Health-based platform in Africa. And we're coming close to the end of the webinar today. Our time is fast spent. I can give opportunity to one of our participants to contribute for 2 to 3 minutes, just to say something on the subject matter today. If any of our participants would love to contribute, you can signify by raising your hand, and we'll give you opportunity to speak for about 2 minutes. Mr. Dr. Abubakar Usman, I can see your hand is raised. Secretariat, can you unmute Dr. Usman for him to speak for about 2 minutes, please? Dr. Usman, you can make your contribution, please. Dr. Abubakar, can you unmute yourself and speak? Yes, go on, please, Dr. Usman.
It appears I have some little network issues.
So can you please go on with your presentation, with your contribution? Okay, I think there's an issue with Dr. Usman. Okay, can we take one more person? Can see Kedar Azan is raising up his hand. Can Secretariat unmute Mr. Kedar Azan to speak for about 2 minutes, please? I think we're having some issues with participants speaking today. Maybe next month we'll give opportunity.
Hello, can you hear me?
Okay, we can hear you now. Can you go on, please?
Okay, so I raised my hand, but you haven't mentioned my name. I'm Abraham Alabi.
Okay, please go.
Okay, thank you very much, Mr. Moderator. And thanks to our two presenters, which are really very excellent. I really want to emphasize on what Professor Mark Mendelsohn said, really, that of this need to really for countries to prioritize the action plans. So like he explained, the global plan is for global community, and we know there are differences between countries within Africa, between Africa and the North. So really it's essential that each country needs to really prioritize their needs and their action plans based primarily on their resources like manpower, finance, and emphasize more on where they could really make the most effective impact. And on the part of the African CDC, one cannot thank them enough for what this organization is doing for Africa, particularly in terms of health and AMR in particular. I just want to encourage them and to continue to double the effort. And I think the impact is already being felt in terms of personnel trained, laboratory strengthening, and that I am now able to analyze. So it's just to say, to commend everyone that behind these presentations, and that has been very useful and very educative. Thank you very much. And thank you, Excellency, also for your moderation today, Dr. Ayodotum Babadoye. Thank you, Babadoye. Thank you, Bobadoye. Thank you very much.
Thank you very much, sir.
Okay, thank you.
Thank you for your contribution. We'll sincerely appreciate that. And I think we're coming to the end of our program today. But before we go, let me inform us that next month we'll be having a special webinar section on monkeypox. The World Health Organization and African CDC declared monkeypox just this month a public health emergency of international concern, which is called FEC, and that shows the increase in number of that shows the outbreak of monkeypox we are now having in multiple countries, especially in Africa and some few countries outside the continent. And because monkeypox has been declared as a disease of importance by WHO just this month, GET have decided to bring together subject experts from African CDC, WHO, and other organizations to discuss the issue of monkeypox on the continent of Africa and how we can develop strategies and look for collaborative efforts to effectively address this new emerging challenge we are having on the continent. So join us, please, next month, by God's grace, to discuss monkeypox and how we can have a collaborative effort to address monkeypox on the continent. So we've come to the end of the webinar series today. I want to say a big thank you to our presenters again for the wonderful presentation and educative presentation. We really appreciate your presentations, and I've learned so much today from your discussions. And I also want to thank our participants. They are the reason why we will do this every month. Today, like I said, we have about 250 participants from more than 30 different countries. Thank you very much for participating. From Global Emerging Pathogens Treatment Consortium, GET, the organizers of this event. I'll say bye and have a wonderful rest of the day. Bye-bye.